Good morning, good morning. Trying to set up there.
Good morning.
Good morning.
How's everyone doing today?
Good, good. Chuck's is one of our newest members. We haven't even had a chance to meet yet, Chuck. So looking forward to that next week.
Yeah, sure. Yeah. I have that on my calendar for, I believe,
Yeah.
Tuesday.
Yep. Great. So, okay, let's get started. And then if more people join, that will be great too. So, today we have Dr. Gregory Dean. He is the founder and CEO of DriQ Health, whose is it IoT enabled smart brief platform delivers real-time moisture and movement analytics that transform continence care in senior living communities. A subspecialty board certified pediatric urologist educated at Columbia University and the Children's Hospital of Philadelphia. He has spent more than 2 decades refining surgical and technological solutions for neurogenic bladder and incontinence, and now serves as the chief of pediatric urology at St. Christopher's Hospital for Children and associate professor of urology at Temple University. Dr. Dean currently chairs the American Academy of Pediatrics section on urology and is a past president of the American Association of Pediatric Urology and has been honored repeatedly as a Castle Connolly top doctor. His career spans global invited surgical demonstrations, journal peer review, and leadership roles in clinically integrated networks, all of which fuel his mission at DriQ Health to bring data science, connected devices, and dignified care to millions living with incontinence.
Thank you very much. That's very nice. So I'm going to see how I can. Okay, I'll share my screen and let me know if you guys can see it. So I should be sharing right now. Can everyone see that?
Yep,
Okay, good.
great.
And I'm going to go to present here. Just move this so I can present. Okay. I'm going to actually just wait a second. I'm going to go to the site directly. Okay, everyone can see that? Okay, good. So DriQ, again, this is our company. We've expanded since the last time I've spoken, and originally we were focusing on solely incontinence care, and then we realized that from a risk perspective and a functional perspective, that there were other things that we could do to provide help. And a lot of people, when they hear our company, they want to know DriQ. They look at it. Some people aren't sure how to pronounce it. Paige, you did a great job. But basically, it's a contraction of the word dry and IQ. So, moisture detection with actionable intelligence. But then again, we've expanded beyond that. And it's all about empowerment of your staff, empowerment of your residents, improving their dignity and independence by proactively keeping them dry, and making sure that they're safe. So, what do we do? Our solutions include incontinence monitoring. So we're providing real-time moisture detection, and that enhances the patient's comfort, safety. But it's also doing something which is fall risk mitigation. What is well understood is that incontinence is a driving factor toward falls. Additionally, there's other factors that we know can increase falls, which is movement from the bed, let's say, to the bathroom. If you have a resident who is relatively frail, knowing that they've gotten up, knowing that they're moving, that they're wet, gives you the signals that can lower the risk that they're gonna fall. So we provide the really only integrated care solution for these problems that's currently available. So, what makes this different? So we have a battery-free sensor, and I'll get into that in a little bit. But one of the tasks that you have when you're running your home is there are lots of things to do, and one of the things you don't want to do is worry about batteries, worry about battery that needs to be changed, and so our design eliminates that. And what we do is essentially place a sensor on the outside of the adult brief. And when the brief starts to get wet, you're going to get real-time alerts to phones, tablets, and any sort of monitoring PC that you have within the home itself. There's no special briefs that you have to buy. You can go down to Walmart, use the current briefs that you have. Some homes will ask families to provide their own briefs. You can continue having that system in place. You just use our disposable sensor system. And then you can follow data over time and see what's actually happening. That's me, created by a urologist, solving an unmet problem. And again, we're looking at combining our understanding of incontinence, what causes it, how it can cause problems, and then employ digital science to bring those two things together to lower the risk for residents. This is a massive problem. If you look at the cost in the United States of falls and incontinence, it's approaching over $100 billion. One of the things that's frightening is if you look at falls within nursing homes, and again, this is not residential assisted living, it's senior living in general, almost 2,000 seniors die a year because of falls. We know that falls are a huge issue. Over 14 million adults fall per year. But we also know that the risk of falls increases between 2 and 5 times if you have incontinence. So we know that's a major driving force within senior living. And then falls in of themselves, outside of the cost of falls, incontinence itself costs about $25 billion per year in the United States. So what is the value outside of that of real-time incontinence notifications in assisted living? We know that depending upon the protocol that you're employing, you may do manual checks every 2 to 3 hours. But what happens is you could walk into the room, manually check that person, determine that they're dry, walk out, and then instantly they wet. And then they're going to be in a wet brief for 3 hours. So we know that cumulatively, seniors spend 6+ hours a day in wet briefs, even if you employ manual checks every 2 to 3 hours. And that increases fall risk. It increases the risk of skin breakdown. The other issue that we have with current methodologies where you're going in and checking is that you're going to be waking individuals in the middle of their sleep. We know that impacts their quality of life. It's also a major drag on your finances of your home because you need more people to run the home. And if you can do this in a more automated fashion, you're going to improve your efficiency. You're going to improve the quality of the resident's experience. So this shows DriQ. This shows our sensor, and it's going on the outside of a brief. And I'll go into a little bit more detail with that. And basically, here's a sensor on the outside of the brief. You can see that it's just a little sticker. And you see the no battery. That's critical because, again, if you're in a residential assisted living property, the last thing you want to do is place sensors on adult briefs and then worry about having them change. And again, it really does help your staff, frees them up to focus specifically on care, not incontinence checks. So the reason that this works so well is that you might say, well, we don't want to put these on and have someone immediately get called because they had a little moisture. And the reason that this is a smart system is that the moisture, because the sensor's on the outside of the brief, the moisture has to penetrate all of the levels of the brief before there's signaling to say that they're wet. And that's important because briefs are designed to contain some small amount of wetting and not require changing. It's not a single layer, it's multi-layered. You have the choice of using very heavy duty briefs, and those briefs will keep the person comfortable until there's a significant amount of wetting. Or you have the option of using very thin briefs, which really require changing immediately. But because our sensor's on this outside, you know that when the wetting occurs, it's truly time for the brief to be changed. You're not changing briefs more than you were in the past. But with this, you're keeping people comfortable. And when they are changed, it's time for them to be changed. When we first built our system, we just had notifications on a computer dashboard. And we realized that that's not the way people live anymore. And so we built apps that work on iOS, Apple phones, Android phones. They work on tablets. We also send emails, and there's a potential for text alerts if that's your preference. And then we still have a direct dashboard that's a web-based dashboard. So if you're using a computer, you can look at a computer. And these give instant push alerts. The device itself, which I'll show you in a moment, will also change color when someone's wet so that if you're walking by a room, you can see a color change. So there's many ways that you will be informed. Let's go on and talk about falls again. And I think this is where we're going to leave what you had seen previously during the prior presentation. We know that falls occur in the room or bathroom most of the time, 75% of the time. And we know that almost half of the time it occurs with toileting. Most of them are unwitnessed. So this is a major risk for all of us. You have your home, you know that most of these falls are going to occur in the bathroom or in the room, and you're not going to see them. So how do you even know what's happening? We know that the likelihood I showed of having a fall increases between around 1.5 up to 5 times if you're incontinent. And we also know that within senior living, the likelihood of falling is about 1.7 per year. So there's a reasonable chance that you'll fall more than once a year within senior living. And so that's where we brought in a new feature within our system. So we have a wristband, comfortable, discreet wristband that remarkably can go for months or even over a year without a battery change. It's almost essentially a disposable device. You've seen these alert systems that you can buy on late night television where someone will have a call assist. The problem with those call assists is that they go through a central operator. They might call 911. That's not this. This is going to call your staff, notify your staff on their phones that they've wandered. Okay, they've wandered outside of their bedroom. Perhaps they have some memory care issues, and that they're now moving down the hallway in the middle of the night. But it does more than that. So in the center of this is a button, and if you push that button, this essentially creates a call system. And obviously within residential assisted living, you're not going to have likely a nurse in the middle of the night, but you're going to have your staff. So if someone does need help, if they have fallen on the ground and they need help, then you can push that button. I see actually one of my associates is on the call right now. He's another physician, but his mother, who's not in residential assisted living, but she's in senior care. She fell last year and she was next to her bed for 4+ hours and nobody knew. And if she had this, she would have pushed the button and then immediately known. So again, this solution crosses all these major issues in terms of notification, in terms of wandering, and in terms of incontinence. How do we connect to the system? Well, you might have we have two hubs. One's a mini hub, one's a bigger hub. The mini hub, which you can see here, it's just a little puck, an LED puck. This is something that's designed for some of your residents who are not incontinent. You don't need to know when they're wet because they're not wetting. So we have a mini hub that you can place in the room. The resident wears the wristband, and it provides the SOS call, the help button, but it also provides the geofencing if you want to know whether they wandered or not. And then we have our more standard hub, which you're seeing Andrea. She's helped us with DriQ. She's holding the hub there. And that hub's a little bit different. It has additional features because it also notifies when an incontinence event occurs, and it actually changes color. So that's the underlying hardware. So again, we're providing a comprehensive solution to all these problems: moisture detection, mobility monitoring, reducing falls by essentially combining both of those factors, and then adding in call assistance with the ability to push the button and then provide notifications that your resident within your home needs help. This is what some of our caregivers say. Why wasn't this invented before? It's life-saving. Thank you. It can make the caregiving within any facility easier. And so, why us? Again, enhanced safety, preserved dignity. It's unlikely that you would be using, there are some systems that are used in nursing homes, which are suction systems, where people apply a suction device to the genitals of their residents and then just constantly aspirate liquid, which is, again, while it might help in certain situations, it's not aligned with dignity. This is very dignified and maintains a sense of worth for your residents. And then it can significantly reduce the workload within residential assisted living. The core advantages include the fact that it's battery free, that we have all these ways of informing you regarding what's going on. There is data so you can see what's actually happening, and it's easy to set up. It's based on Wi-Fi. If you have Wi-Fi within your facility, then you can do this. There's no complex IT system that has to come in. People have to lay cables, or you have multiple people setting this up. It's quite simple. Some people ask me, can you have more than one system if you're having double rooms? The answer is yes. This shows the blue color of the hubs, just showing that these residents are dry. So yes, you can do more than one room. This is a home care trial where we saw that the response time improved 270%. We saw 40% reduced brief use during this trial. And then you can look and record when briefs are changed. So you can drill down and look at data if you want to look at data. This can help create care plans. You can use it to optimize staff. You know where you might need more staff, when you might need more staff. And then it allows you to react in real time and not go on with this 2-3 hour check and change, which again can lead to people lying in wet briefs and potentially trying to self-assist and then fall. So, for a residential assisted home, what does this look like? We believe that it's going to give you improved health outcomes. We think that it likely will reduce your liability. I know that's a topic no one likes to talk about, but I think that we're aligned with that. It's going to give you a competitive edge. When you're showing your facility and you have walkthroughs by families, the children are in there, 30s and 40s, and they understand technology. And when you show them that you have this technology in place, I think it will easily give you a strong competitive advantage. It's also going to help you with staff efficiency. You might be saying, oh, on my overnight, I'm not sure if I need one or two people. And you can see you have a new resident that's causing or having more issues with this. And then you might need an extra person or not. You might have two people and then realize, oh, I can manage with one with this system. So it can, again, align well with what you really need to do. And it is a potential a new revenue stream for you. Some residential assisted living facilities do pay for or do charge for incontinence management. And this is an opportunity for you to really deliver high quality incontinence management and show this option to families. And again, that depends on how you market and sell your services, but our costs are low enough that you don't necessarily have to charge. You can just roll that into your general costs, but you do have that option. We have devices in stock, ready to ship. If you're interested in a trial, we're happy to proceed with that. And here, again, you can't click on it, but clicking on that will take us to our website. I'll move this up. So if any of you are sitting there and you want to go to our website, you can always use your phone to use a QR code. But I think that's a good overview. I'm going to get out of stop share and then open the floor to questions.
Thank you so much, Dr. Dean. This is so cool, and it kind of gets my mind thinking, because my background is I guess early elementary, also working with children with special needs. And so I'm thinking even with that, and like especially with like dignity, because in the past, especially with kids that weren't toileting yet, having to constantly check their diapers, and that's so something that they hate. And so being able to have something where you don't have to go in and like invade their personal space. You don't have to like pull that diaper open to like check or, take them to the bathroom all the time. Like this, is a lot more dignified. So I think that's very cool.
I think that when you may have someone who needs extra help and you don't really fully realize it. For instance, if you are changing their instantly wet, one of the things that we know in urology is that particularly in men, you may have some outlet obstruction where the prostate is blocking the bladder and they're just dribbling and they're in overflow incontinence. They're at risk for getting urinary tract infections or kidney damage. But if you start to see these patterns, then you're going to say, this just doesn't make sense. And then you know that you can talk to the family about organizing a visit with a urologist. So I don't want to veer off and say you're going to be using this for medical diagnostic purposes. But when you start to see patterns that don't make sense, you can identify people who do need help.
Totally. Yeah. Yeah. Great. All right. Well, we will open up the floor. Does anyone have questions, comments?
Yeah,
I
so
think
I was going to, oh, sorry, go ahead.
Oh, sorry. No, go ahead.
No, I was just going to ask, so can you integrate the application with other applications used? Because I know in healthcare they use a lot of different applications. So is there something you can integrate that with, or just it has to have its own?
I mean, with respect to integrations, there's obviously, within hospitals, we have healthcare EMRs, electronic medical records, and there is the ability to integrate potentially to look at care plans. But what I would say is that our notifications are going to be generally more real time than you're going to get in most EMRs. Now, within residential assisted living, I know that originally we had talked to one of the providers for EMRs for residential assisted living, and those talks are I would say, still in progress. But if someone came to us and said, "Hey, we're using this, we really want to see how we can integrate it," it's not that hard to do. It's really a question of, if you have a need, then presumably others have a need, and we'd be interested in it. But the nice thing about this is it's standalone. And I think when you talk about systems, what you don't want to have are multiple systems that you have. If you do have, let's say, wander management, you're going to have one platform. If you have nurse call or some sort of assist call, you don't have to have another system. You can bundle it all together and have essentially one streamlined platform that's going to provide all the information that you need.
Awesome. Thank you very much.
Thank you. And I think that, when some people ask us about cost, because obviously you're sitting here thinking, this looks cool, but what does it cost? Generally we have a cost outside of the equipment, because we have sensors. We're providing essentially 90 sensors a month with our customers. So each person that you're monitoring will get 90 sensors per month. They would also get all the connectivity, all the backup support, and that's a little over $100 a month per person. If you start to have more than one person, that can drop down to about $100 or a little under $100 a month. But again, if you look at the total cost of care and the amount that you're saving, you're going to see that's a very modest cost. And then again, you have the ability to also assign that cost directly to families. And even we've seen families are prepared to pay significantly more for those services. So you can use this as a potential revenue stream as well within your facility, or just open it up and then have more beds filled. Because people are going to then say, "Wow, Chuck has got this system, and why do I want to go down to Sleepy Hollow down the street? I want to go to Chuck's property."
And correct me if I'm wrong, but I think I remember last presentation you did in April, you talked about how a lot of times these sensors are needed for certain people only at night, because in the day they're walking, they're up, they're, moving. So
That's right.
is that correct? Where I guess you said 90 sensors a month. I guess what would
That's
like 3 a day kind of?
3 a day. And if you need more, it's not a big deal. Like, that's not going to markedly change the numbers. If you have more than one person, someone might need less. And that's absolutely correct. In order to get the ability for us to monitor without batteries, we have to be close to our hub. And so this is really designed for that bedroom space. And you saw that from our data that, again, falls and incontinence, the critical time is when people are not being monitored. If someone is walking around, they're able to go to a bathroom, they're able to do their own toileting during the daytime, and all of those risks drop. So it's not used during those times. It's really used for your residents that are in their rooms at night or spend a lot of time in their rooms. It looks like Angela had given a question about speed. And I would tell you that with respect to the nurse call, it's instantaneous. With respect to moisture, how quickly does it detect? As I was showing Paige earlier, the moisture will percolate through the brief, so that if you have a thin brief, it will be instant. Okay, if you have a thin brief, because as soon as it's used, one single wetting event will result in incontinence being signaled, and that would take, I would say, as it's percolating through a thin brief, probably 5 or 10 seconds. If you have a thicker brief, it's going to take more time, not because it's slow, it's because that brief is not ready to be changed. You're choosing to use a thick brief because you know that resident can tolerate that. And we have tested briefs extensively. We've gone to Germany and looked at brief design, and the way that briefs are really designed. You can buy in Europe and in the US are expensive, but they're briefs with specific capacities. So you can have a 200 milliliter brief. You can have a 1 liter brief. A 1 liter brief is designed to put in up to a liter of urine and keep the skin dry. Because what happens is that urine will go in and it'll percolate through and the surface of it dries out. And it's still, you might put 750 milliliters in. The skin is dry and the sensor has not even seen it because there's more capacity for it to hold. But once it reaches that 1 liter mark, it's penetrated all levels and then it's time to change. And without sensing that, using those big, heavy briefs is impossible. You have no idea when it's time to change those. And so our system actually allows that changing to occur at the right time. But I know that's, Angela, that's a long response, but that's how that technology works.
All right. Anyone else?
And I would, again, anyone who wants to learn more, what I'd recommend is that they go to our website. I can, if you'd like, I can through Page also give you a link to this presentation so that you can look at it and work your way through it. And at the end of that presentation, when you click on the link for our website, it'll connect directly to the website. And if anyone's interested in a trial, we can talk about our trial program. But I know that what you're doing is important. The care that you're giving in a home-like atmosphere really makes a difference. And I think that this technology will allow you to run your home in a way that exceeds anyone else in your community in terms of their technology and what they're doing, and really will make the people within your home and under your care really thrive and I think will be a benefit to you.
Totally. Yeah, this has been really cool. And we will put this recording in school and we will attach the presentation so that, they can go through on their
Yeah, just
own.
use the direct link and the first one, and that'll work beautifully.
Great.
Well,
And
wonderful.
I don't know if it was on your website or if it was in a past presentation, but I know you showed a video of showing real time, like pouring water into a brief and seeing how fast the sensor did, recognize that it was, fully, I guess, saturated would be the word.
Yes,
Yeah.
I could show that. The reason I didn't, and I can, but I mean, I can, but it wasn't within the structure of that presentation. It's hard to put videos in. That's why I didn't do it. Ken, thank you. I just saw he said he saw 15 homes. He didn't see anyone with this. So imagine those 15 homes in your community, and now you have the home that does this. I think when someone walks in, they're going to be like, again, it's going to be of great benefit. And we've seen that as well, where someone may come and they may see that someone's doing it, and they're like, my father or mother doesn't need this right now. But when they see it, it doesn't matter that they don't need it. They know that when they do need it, it's going to be there for them. And that the home that's doing it cares enough that they're solving this problem.
Mm-hmm.
Yes, it was a really good presentation. Thank you. Sorry, I don't really have any comments besides that. We're in the process of hopefully buying one soon. But yeah, I just like it's remarkable that, and I don't think that the cost is like wildly prohibitive, nor do I think it's unreasonable to pass it to the family. I think that the family would want this. So, anyways, I'm just shocked that nobody. And I kind of know why too. Those homes weren't doing particularly well. So, anyways,
we want to
yeah,
get the word out. We want to get the word out. We're a small company. We're small, but we are scrappy, and we really want to get we really want we want moving forward. I see from Angela. Angela, thank you. She just sent something that she's interested in a trial. So, Paige, I just saw that go by. Maybe you can send me that the link for Angela. So that sounds great. And Ken, for sure. I mean, as you're, and I think that when you are, again, showing your property, having, you can even have one device to show that you have this and demo it. And the demo, as Paige said, is pretty dramatic. We can show you how to demo it because you can just essentially take one diaper and then put the sensor on the outside and lay the diaper on the bed or the adult brief, and then pour that liquid and then see it change. And people immediately get how it works.
Mm-hmm. Yeah.
Thank you.
Well, thank you. Thank you. Any other questions that anyone has? We're a small company, and as I said, we're always available to talk, chat, if you have any thoughts or further questions. When you go to our website, there's a contact sheet on there, and you can put a question or ask us, and then I'll be sure to return it or call you up. So thank you very much. And Paige, thanks for allowing us to come on and invite me back anytime. I'd love it.
Yeah, great. Thank you so much. Yeah, and also I feel like we talked a lot about the incontinence, but also the fall and I guess, wandering is super important too. And having it all in one is really important so that you're not, going around to all these different apps and things like that.
You just want to know, is my resident, what do they need? I mean, because they're getting fed, so you're not worried about that. They're warm. Your thermostat is keeping your home warm, but all these other risk factors, you just don't know.
Mm-hmm. Mm-hmm. Yeah.
So, and I think even if you look and add up the cost of, let's say, a nurse call system, you're going to spend a fair amount of money, and it won't be as networked as this one is. It's not going to go directly to people's iPhones directly in real time. So you're getting a lot of add-on services because of our networking understanding that we can sort of roll things together and keep it at a higher level, more functional.
Yeah. Yeah. Very cool. Very cool. Well,
thanks.
thank you. Yeah. Thank you for having, thank you everyone for coming on a Saturday morning and listening in. This was really cool. And for anyone listening to this, after it's been posted in school, if you have questions, email me and I will get them to Dr. Dean as well so that, you have all your questions answered. And yeah, we will
arrange for a call and I can call anyone who has questions as well.
Yeah, great. Yeah, we'll set that up. But yeah, thank you for being on this morning and have a great morning.
Thank you, Paige. Thank you, everyone. Bye-bye.
Bye.